The last couple of things I want to talk about are behavior change myths and examples. And I really want to take some highlights from a TED Talk by a health behavior scientist from Colorado. And basically, her name is Jenny Cross. And I've given a link at the bottom of these slides if you want to see the whole thing. But she talks a little bit about 3 myths of behavior change. And myth number 1 is education alone, or education will change behavior. And I want you to look at these 2 examples of a communication model of how to reduce littering. And one, option A, is a telephone booth, a box full of litter, and it's really trying to increase awareness about the seriousness of the problem. This is how much litter we have. The second option is a local person who happens to be an Olympic athlete who is saying, I love my city and I want, let's help keep my city clean. And we'll come back to this, which might be more effective approach to reducing litter. One of the things that's important in our messaging is how we talk about stuff is very important. And 3 things to keep in mind are that it's very tangible, that people can feel it and touch it, that it's personalized to the group that you're trying to talk with, and that there's interaction between the communicators. This particular example is a result of an effort to change behavior around weather stripping windows to make sure that you didn't get heat leaks. It was very inefficient, poorly ventilated, poorly sealed, not ventilated windows. And they wanted to make it very concrete and tangible how much air, warm air, you're putting out into the environment if you have a little tiny leak in your window. And they basically said if you have even the tiniest leak, you would lose a basketball full of air for every day. And if you have 27 windows, you have, with any leak, you have this much. So instead of talking in numbers, it was talking about amount of air and something that was very tangible, personalized, and that they could understand and relate to their own experience. A second myth is you have to change attitudes to change behavior. And we do this in public health all the time. We ask people what we call a knowledge, attitude, and behavior survey. What do you know about this? What do you think about this? What are you actually doing? And we think sometimes we have to change the knowledge by telling them what they should know. We should change their attitude. And we should also do all those things before we get to behavior. But the reality is that behavior comes first. If people do the behavior, even if they don't understand why or if they don't know, their attitudes can follow. And this has been shown in many different ways. And so then, much like we say that in social marketing, you need to decide what behavior you want to change and be very specific. Here, you want to be very clear about what behavior you want people to do. This example is from a hotel, a message that say, thanks a watt, we want you to turn off the light. It's being very specific. So in your messaging, if instead of trying to change an attitude or trying to change knowledge, just tell people what to do. In some ways, we say this is that fake it until you make it. Do the behavior until it becomes normal. So you don't always have to change attitude first. But values really matter. How you talk about a behavior change is more powerful when we connect it to people's values. And you need to understand what people care about. Is it the environment? Is it knowledge? Is it how resources are used? How much it costs? And once you know what is valued in the community, you can be very focused in your messaging. A third myth is that people actually know what motivates them to take action. And people actually do think, like, why do you do this? Well, I care about the environment. Or I do this because of my family. But what many, many studies have shown over time is that we are most influenced by what other people do, regardless of our own motivations. And we call this social norms. And social norms really matter, both good social norms and harmful social norms. So in this example, if you see a street musician, they often will seed their guitar case with money so that people will understand and think, oh, somebody else thought this was worth listening to. Somebody else gave money. And we actually can think about social norms as an important way to influence behavior, independent of what people think influences their own behavior. So if we look back on these two examples about which would reduce littering, and of course it depends on your specific community and what you've learned from your own research, but in general, A would be a potentially unintended consequence of reinforcing a negative behavior, which is littering. Look, our community litters a lot. And instead of seeing money in a guitar case, you see litter in a box and you think, oh, it's okay to litter here. Whereas here on item B, you have a positive strength-based message by a person that people probably admire. They were selected for their role model status. And they're giving very specific positive directions. Let's keep our city clean. I love my city. Let's keep our city clean. So from the literature and from a lot of history, we would anticipate that B would be a more effective approach to reduce litter. The other example I wanted to give is from a non-governmental organization, which actually won a Shorty Social Good Award for best use of a hashtag. So this is an example of a organization that's very interested in sanitation and hygiene, that is using social media, and they're using social marketing, and they're taking a strength-based approach, and they're very interested in participatory approaches. And I think there's a couple things that are kind of clever, and if you're interested, I've also linked the website at the bottom of this talk. They say that good sanitation doesn't begin between the buttocks, it begins between the ears. And that's us listening and them having an exchange about why people do what they're doing now and how to make best use of the most appropriate approaches to sanitation in that area. Because as they say on their website, and we've heard already in this course, a good toilet, only a used toilet is a good toilet. You can have the best designed equipment, but if nobody's using it, no one knows how to keep it up, then it's not a good toilet because it's not achieving its purpose. The third approach is also linked to that NGO website, and you'll see that there's some parallels to social marketing, but I thought I would add it here because it's another way to think about those important steps of behavior change, and they call this designing for behavior change. And on the link that I've provided here, you'll see these steps. But basically, the first one, again, is to decide, clear and without any confusion, what behavior you want to have happen. And second, decide who is supposed to do that behavior. And then third, they call it formative research and barrier analysis, to figure out what are the reasons that people aren't already doing that behavior. And then they think about, well, in this particular context, how can we support people to do that behavior? And then they actually do the behavior and measure it. So they have resources and examples and other ways to use this. So I think that's a good, another tool for your toolkit. And then the last comment I want to make is we've heard in this course already about one of the sources of pollution and confusion in our wastewater and our black water, gray water, is personal items, pharmaceuticals, personal care products. And it's important to remember, in most places that don't have good sanitation, there's a large portion of the population that are women of reproductive age, which means that they are probably menstruating for some part of their life, and they have a current way of dealing with that. And if you introduce a new way of dealing with sewage, and you're not thinking about what else people are doing, you may not come up with the best solution. So what I like about this approach, and this is a menstrual hygiene manual for people who are designing sanitation systems, is to recognize you might not be the best person to talk about this. You might not be culturally appropriate, but somebody on your team should be aware of the fact that there will be multiple perspectives on whatever sanitation system that you come up with. And women have historically been very underrepresented. And yet they are often the ones who decide what happens or doesn't happen in the home. So what have we learned? That sanitation and public health, engineers and public health should be working together, and all of us should be working closely with the communities that we are trying to help or learn from. And we should build on what we and others know, that we all have different kinds of expertise. If we can, we should take an approach that looks at strengths, what's going well, and what are people doing well. We reinforce that, and we try to apply and appeal to values. What is important to the people that we're working with? And in all of our planning, implementation, and evaluation, we try to engage the community as much as possible. And if in your team you don't have somebody who cares or knows much about behavior change or how to engage people or talk to people about health, then you probably need a few other people on your team. And then to recognize whoever's on your team, it's possible that we can do unintended damage in our effort to make things better. And so we always have to reflect on our practice. We need to ask how we're doing, we need to think about how we're doing, and try to go forward together. So thank you very much.